Osteoarthritis can be painful, but there are a number of medications that may help. Many people with osteoarthritis benefit from non-steroidal anti-inflammatory drugs, or NSAIDs. One type of NSAID is a topical gel that you can get over the counter. Here's what you need to know if you're planning to use this medication. In general, NSAIDs work by blocking certain proteins in your body from making prostaglandins. These are substances that can cause pain and swelling when you're injured. What makes topical Diclofenac unique is that it's not a pill. It's a gel that you apply to the skin where you're having pain. This helps treat joint pain and swelling caused by osteoarthritis. This medication can help treat pain in most joints in the body, especially the knees. But it's not helpful for osteoarthritis in the hip. That's because this joint is located deeper in the body, and the gel isn't able to reach that far into your skin. Over-the-counter Diclofenac gel can be applied up to 4 times a day. To apply, shower or clean the skin first. Use the prescribed amount, which varies depending on which joints you're applying it to. Avoid applying it on any open cuts or wounds. Avoid using any other topical products, such as a lotion or sunscreen on the treated area. Be careful as you wait for it to dry. Avoid bandages or heat packs on the treated area, which can affect how much gets absorbed. Avoid touching pets or other people, which could cause the medication to transfer to them. Your medication may look different depending on many factors. Both your prescriber and your pharmacist can answer questions or provide tips about applying topical Diclofenac. For example, you should know that topical Diclofenac may not provide immediate relief. You should see improvement within a few days and start feeling much better after a week or even a month. Both your healthcare provider and your pharmacist can answer your questions about side effects. For 1% gel, this may only cause skin irritation and dryness. You may reduce your risk of side effects by using the gel as directed and not applying too much or too often. You should also avoid taking oral NSAIDs, like ibuprofen, while using topical Diclofenac. This can increase your risk of serious side effects, like stomach bleeds, stroke, and kidney problems. Don't be afraid to ask your pharmacist or provider about affordability. These days, there are many low-cost ways to get your medication.